The content of this video is for informational purposes only. Nothing contained in this video is or should be considered or used as a substitute for professional medical or mental health advice, diagnosis, or treatment. Of all the factors which affect the mental health, insomnia is also one of them. A sleeping disorder, otherwise called restlessness or insomnia, is a rest issue in which the person has trouble sleeping. They may experience issues sleeping or staying asleep as long as wanted. A sleeping disorder is ordinarily trailed by daytime tiredness, low energy, touchiness, and a discouraged mindset. It is a sleep disorder that routinely influences a great many individuals around the world. Types of insomnia. Insomnia basically includes different sleeping disorders, including lack of sleep quantity and lack of sleep quality. It is separated into three types. Transient insomnia. This insomnia occurs when symptoms last for up to 3 nights. Acute insomnia. This is also termed as short-term insomnia. Its symptoms remain for several weeks. Chronic insomnia. This type of insomnia usually lasts for months and can also last years. These insomnia cases could result from a different basic problem. Symptoms of insomnia. Insomnia itself might be a manifestation of a hidden medical condition. In any case, there are numerous signs and indications that are related with insomnia. Trouble falling asleep during the night, waking during the night, waking sooner than wanted, as yet feeling tired following a night's rest, daytime exhaustion or tiredness, touchiness, sadness or nervousness, poor fixation and core interest, an increase in errors or mishaps, trouble socializing, gastrointestinal indications, agonizing overdosing. Lack of sleep can cause different side effects. The individual may wake up not feeling completely alert and revived and may have an impression of tiredness and sluggishness for the duration of the day. Having issues focusing and concentrating on undertakings is normal for individuals with insomnia. Causes of insomnia. Insomnia can be brought about by physical and mental variables. There is once in a while a hidden medical condition that causes insomnia, while transient insomnia might be because of an ongoing occasion or event. Insomnia just keeps going a couple of days, and it may leave depending on what you do to help it, particularly when a sleeping disorder is attached to an undeniable transitory reason. For example, worry over a meeting, a difficult separation, jet lag, work move changes, high heights, noise, extraordinary warmth or cold. Nervousness, stress, and discouragement are the absolute most basic reasons for a sleeping disorder. Experiencing issues dozing can likewise make tension and stress side effects more awful. Other normal passionate and mental causes incorporate indignation, stress, distress, bipolar confusion, and injury. Treating these basic issues is fundamental to settling your sleeping disorder. Medical conditions including pain, fatigue, heart failure, angina, pneumonic infection, asthma, Parkinson's and Alzheimer's maladies, hyperthyroidism, joint pain, mind injuries, tumors, stroke. Hormones including estrogen, hormone shifts during monthly cycle can also be a reason. Numerous physicians-endorsed medications can meddle with rest, including antidepressants, stimulants for ADHD, corticosteroids, thyroid hormone, hypertension meds, and a few contraceptives. Regular over-the-counter offenders incorporate cold and influenza drugs that contain liquor, torment relievers that contain caffeine, diuretics, and thinning pills. Treatment for insomnia. A few sorts of sleeping disorder settle when the basic reason is dealt with or wears off. Sleep deprivation treatment centers focus around deciding the reason. When distinguished, this fundamental reason can be appropriately treated or amended. Notwithstanding treating the hidden reason for sleep deprivation, both therapeutic and non-pharmacological conduct medications might be utilized as treatments. Persons suffering from insomnia could try going to a psychologist who could help in determining the problem and resolve the issue. Two amazing weapons in the battle against this sleeping disorder are a calm, agreeable rest condition and a loosening up sleep time schedule. Both can have a major effect in improving the nature of your rest. Ensure your room is tranquil, dim, and cool. Light and a room with noise or one that is excessively hot or chilly or an awkward bedding or pad would be able to meddle with rest. Use various degrees of bedding and pads that give the help you have to rest easily. Use earplugs to cover outside noise and an open window to keep the room cool and blinds or an eye veil to shut out light. A white noise machine could also be used, which produces a soothing noise to calm a person and can help them to sleep well. Or, if you don't want to spend money, you can also download sleep apps from Google Play to help you get a sound sleep. Adhere to an ordinary rest plan. Bolster your organic clock by heading to sleep and getting up consistently, including ends of the week. Get up at your typical time in the first part of the day, regardless of whether you're worn out. This will enable you to get an ordinary rest beat. Don't try to Netflix and chill, or in other words, watch TV an hour before you go to sleep. Electronic screens emanate a blue light that upsets your body's generation of melatonin and battles lethargy. So as opposed to sitting in front of the TV or investing energy in your telephone, tablet, or PC, pick another loosening up movement. For example, pursuing a book or tuning into delicate music. Abstain from invigorating action and distressing circumstances before sleep time. This incorporates checking messages via web-based networking media, enormous exchanges or contentions with your life partner or family, or making up for lost time with work. Defer these things until the morning. Stay away from snoozes. Snoozing during the day can make it increasingly hard to rest during the evening. But if you still want to, snooze for 30 minutes and try to do it before 3 p.m. Don't drink a lot of fluids before sleeping. Waking around nighttime to go to the washroom turns into a more concerning issue as we age. By not drinking anything an hour prior to rest and heading off to the washroom a few times as you prepare for bed, you can diminish the recurrence you'll wake up to go during the night. Do not try to solve the problem with alcohol, the so-called nightcap. While a nightcap may assist you with relaxing and nod off, it meddles with your rest cycle once you're out, making you wake up during the night. Attempt to have supper prior at night and dodge the rich foods before heading to sleep. Hot or acidic foods can raise stomach ruckus and indigestion, and your blood pressure can also rise because of it, which can wake you during the night. Milk or a nightly cup of tea, sans caffeine of course, can be a perfect relaxing ritual as well. Chamomile, ginger, and peppermint are calming choices for bedtime. If you get hungry at night, have a light snack before bedtime. Some foods are helpful and actually promote production of melatonin, a hormone associated with sleep. Try cottage cheese, soy nuts, almonds, and walnuts, chicken, pumpkin seeds, and turkey. Certain fruits that contain melatonin may help you fall asleep faster and wake up less often during the night, like tart cherries, bananas, pineapple, oranges, and kiwis. We know how much people like coffee, but the American Academy of Sleep Medicine prescribes that you quit drinking fluids with caffeine in any event 6 hours before sleep time. Individuals who are delicate to caffeine may need to stop significantly prior to sleep. Hope some of these tips may help. Sleep well.